Now, a couple of people brought to my attention late yesterday that there was news emanating from Wales, where Mark Drakeford seems to be going ever more and more insane, that basically people who have had the vaccine should have some kind of ID card to show to anyone who asks them whether they've had the vaccine. Now, I'm not quite sure how this is going to work because, of course, as we said yesterday, what we do know now about this first vaccine, which is being made available from possibly as soon as next week, is that it's not going to be made available to the general public. It's only going to be made available to people in hospital, it would seem. So presumably that means it covers not only the people who are in as patients, but it also covers the people who are in fact working there as well. But the members of the public who are awaiting a vaccine will not get one for a very long time. So the idea that anyone's going to have an ID card to show that they've had the vaccine in Wales seems to me to be a bit of a non-starter. We'd like to hear from you, of course, 0344 499 1000. Let's talk to Jamie Jenkins, though, former head of health analysis at the Office for National Statistics. He's in Wales, and he may have a view on it. Jamie, very good morning to you.
Morning, Mike.
So, everyone was rather sort of doe-eyed and emotional yesterday, it seems. But like all of these things, life returns to normal the day after. And you look out and it's all a bit gloomy and dark out there. And we still got a lot of questions that nobody seems to know the answers to.
Well, yeah, I think what the announcement potentially in Wales of having this card, it does kind of illustrate the fractured mindset of the politicians with COVID, that devolution is just meaning different things in different parts of the country. Because when I saw the announcement, one of the things I was thinking, okay, well, what is the purpose of it? So one would argue that if you've got this this kind of credit card proof that you've had a vaccine, would that then mean that if you want to go to the theatre, a football match, rugby match, etc., they know you've had the vaccine, so you're a low risk, so you can enter? But let's take a Wales rugby match then. You might have thousands of Welsh people living in England who've had a vaccine in England, don't have a credit card style thing. So how's that going to work? And one of the things, I think the principles of medical information is normally it's confidential. So if you've had a vaccine or not, should you have to prove that you've had a vaccine to go about your normal daily lives? And I think the point you've just made as well, that it's going to be many, many months anyway before the general population would get the vaccine. So I suppose, what are they playing at?
Well, it's a bit of pie in the sky, isn't it, with the Welsh government, it seems to me. They seem to be sort of plucking bits of law out of nowhere. Like, for example, when Mark Drakeford said that he didn't want anyone coming to Wales from England, therefore he was going to ban them from doing so, when he can't really do that, can he?
Well, there does seem to be a kind of a lot of politics at play. I think part of the reason, personally, I think in Wales that we've had different approaches to managing the virus. So if you think you've got the tiered systems coming in England this week, in Wales at the moment, on Friday they're closing all the hospitality sector. So tomorrow, with a national approach, where we know in the northwest of Wales, there's fewer cases in the northwest of Wales than there is in Cornwall, for example. So we're going for this national approach to be different to England. We've got this approach with the vaccine and having this card to be different for England. I suppose, as a resident of Wales myself, I find it kind of strange that you've got, say, the same advice being given in Wales at the moment. Mark Drakeford seems to be conveniently quoting Sage a lot at the moment, whereas he didn't quote Sage a lot at the start when it wasn't convenient.
No.
So it just seems to be a lot of politics at play. And going back to the kind of the vaccine card, I think the critical thing there is we don't have to show our cards for everything else, but it could have a positive thing, Mike, if it means that you can enter venues. But what if that means you can't go to an event because you're low down on the vaccine list? Because obviously access to the vaccine is going to be done based on who are the most vulnerable. So if you're, say, a 30-year-old man and you're not going to get the vaccine until next August, does that mean you can't go to the pub then because you haven't had a chance to get this card?
Right.
So does seem very strange that in terms of how these kind of decisions are being made.
Well, exactly right. And also, I mean, from the point of view just of libertarianism and freedoms and all of those things that people are concerned about, you know, for them just to introduce this as an idea seems quite sinister to me.
Well, we've known they've tried to introduce, there's been ideas to introduce, just say, ID cards nationally for many years, and you can't just introduce that. You've normally got to go through scrutinisation in Parliament, etc. So yeah, just to kind of come up with a policy and introduce it. I think one of my concerns in Wales recently has been that I know in England, Boris Johnson has had to get a vote passed to bring in the tiered restrictions. In Wales, we seem to be having these restrictions imposed on the population, and there's no actual vote even within the Welsh Parliament going on some of these things. So it just seems to smack in the face of democracy, I think.
Well, that's right. And I mean, as far as the way that they're going to shut down all the pubs, the idea that that you're trying to run a business in Wales, right, when most of parts of Britain are kind of at least able to open pubs, you know, unless you're in tier 3. Basically, these people in Wales who own pubs are going, well, I can only open the pub and sell food and soft drinks. Why have they got this sort of kind of obsession with stopping people from drinking?
Well, they cite some evidence that obviously means that when you're drinking a lot, social distancing becomes more difficult. I think, Mike, for me, what kind of the policy seems rather bizarre is that, okay, let's take soft drinks and a meal, etc. So you can go into a pub in the exact same venue at 2 o'clock in the afternoon and buy a soft drink, but you can't go and do the exact same thing at 7 o'clock in the evening. And I'm not sure COVID decides to switch off or come alive at 6 o'clock in the evening. So there's these arbitrary decisions. Now, the Welsh government would argue that when you introduce restrictions and close hospitality, cases come down. But we know even within Wales itself that we've got this exactly the same as England, Mike. We've got a huge variation that the parts of the Wales where I'm living at the moment, towards the south and in the Welsh valleys, much, much higher than the northwest of Wales. If I was a publican in the northwest of Wales, I would be really, really fed up with the way the policy is being made, because it seems to be a blanket approach. And there's a lot of call for evidence on some of this. So a couple of days ago, the local BBC station in Wales asked, I think, the Welsh government to put up the chief medical officer. They asked them to put up the chief scientific officer. They asked them to put up the ministers. None of them would speak about the evidence. So I stepped in to try and talk through what evidence there is, and it was very difficult to find a lot. But when you're actually putting the policies together, there's very little evidence being shared with the public. And that's why, Mike, if you don't have the evidence to back up what you're doing, you start losing the public's confidence.
Yes, exactly right. Because, I mean, you'll know from your time in dealing with all the statistics that you and I have spoken about in the past, that they can always find statistics to work on. I mean, I'm told that Sage in London have been working on a study that was done somewhere in Indonesia in a nightclub as to how those kind of people are affected by drinking, which is barely at all anything like the experience of drinking in a pub in this country.
Well, that's the information I found. So it was 4 days or 5 days ago now, or the 27th, it might be 6 days now, that they issued what they'd called a policy paper, the UK government, but it's not really a policy paper. It's a web page with about 4 or 5 paragraphs citing Indonesia. They also cited some South Korean nightclubs, super spreading events in weddings and thing in Hong Kong, etc.
Right.
So I think you've got to bring it a bit closer to home. I think it's quite clear that you've got a higher risk potentially if you are mixing with people. But this policy in itself could have kind of alternative consequences, is that you can't go and meet friends in the pub where, for example, if you had a pub and people weren't socially distancing, weren't following the rules, weren't doing track and trace, policemen can walk in and say, come on, guys, you need to sort this out.
Right.
Whereas now you could be getting people going to the supermarkets, all coming around their houses and having kind of indoor drinking events where there's no scrutiny going on at all. So you could have the alternative effect where closing the pubs increases the spread of the virus because people will start mixing. And we know in December, it's not like June and in July where people would go around people's houses and gardens and they're all congregating outside.
Right.
It's too cold to do that now, Mike. So are we going to see the consequences of closing all of the hospitality sector increases? Because we do know that in December time, people will want to get together because that's what people do.
Exactly. And I mean, people always do find a way to get a drink in this country because it's one of the things that we do. I was in a pub yesterday and you could not have had a more COVID safe atmosphere. You know, there were people sitting at tables very far distance from one another. There was no bar service. The people came to you and you ordered a drink and they brought it to you. It was contactless payments only, you know, and there was certainly nothing like what Michael Gove described the other day when he was on with Julie Hartley-Brewer. You know, people sort of standing close to each other at the bar. I don't know where he was to see that and to see that recently, but you know, it was about as safe as you could ever get.
Well, if you're quoting the kind of the evidence from nightclubs in the Far East, where I think cases were relatively low and then they obviously kicked up a bit because there was nightclubs. Obviously, the experience you've described there, Mike, is totally different to a nightclub where by design a nightclub is dancing, close contact, etc., that kind of stuff. So using that evidence to say close pubs in Wales does seem rather strange.
It really does. And how long are they going to be shut for over there? Is it 2 weeks again?
Well, the talk is to close them and review them just before Christmas. Now,
Right.
I think the difficulty you'll have is we know when any policy that you introduce, there's a time lag. So even if they close the pubs and if the case is still going up, they'll be used as an excuse potentially to continue. Now, I've heard rumours that they're probably going to continue with this until the middle of January.
Right.
And we know that the UK government and the devolved countries have allowed people to mix around Christmas time. And inevitably that will probably increase the spread of the virus. And then there may be some stringent fire breaks, lockdowns all through January on the back of that. So if you're a publican or just running any hospitality in Wales at the moment, it looks pretty bleak, I think, from now until January. And obviously coming back to the vaccine situation, the vaccine offers a hope, but I still think it's going to be a long time before the vaccine.
Yeah, I mean, I think all of this euphoria yesterday was a little bit misplaced because, quite frankly, it's obvious, as I said, that the vaccine that we are currently talking about is not going to be made available to the public, the general public in any event. We're going to have to wait for the next one before that's going to happen. For most people, it's going to be the summer, I would imagine, before they get past all of the various groups that they have to give it to first. So, I mean, we're talking about, a long way off, really. I was calling yesterday for some kind of roadmap that we could get from Downing Street to say, right, this is what we can do in January, this is what we can do in February. I think that's a very long way off.
Yeah, I think the one thing that I've noticed with the UK government's kind of press briefings is that we were having this world-class test and trace system, which obviously I don't think anybody would say is anywhere near that.
No.
Then we were going to have this, everybody's going to be tested, possibly weekly.
Right.
We know any of that. Now it's the vaccine. So I think they're very quick to kind of maybe to boost a little bit of morale, to put some information out there. But you're right. You've got to then take a step back and say, what does this actually mean? And I can't see the vaccine being fully rolled out. As you say, this one's very difficult to roll out nationally. It's going to be perhaps the Oxford vaccine that's been talked about, where that's much easier to transport and give the vaccine. That hasn't been approved yet. It's when that comes online that's going to probably be where you're going to start seeing the biggest differences.
Yeah.
And I think normal life, even the vaccine companies themselves are saying you're talking the summer. So I think yesterday and this morning talking about the vaccine, we're going to get it before Christmas. Some people will be thinking, oh, we'll be fine by Christmas. No, we're not going to be fine by Christmas. This is going to continue. And we do need to continue, I think, to control the spread of the virus in a sensible manner, looking at tiered restrictions and just bringing it back to Wales, that closing hospitality in the northwest of Wales when cases are very high in the southwest valleys just does seem a very strange policy indeed.
Yeah, and you put out an interesting tweet yesterday with some graphics on the north-south divide. Tell us a bit about that, because what you're seeing is there's a lot more infection in the north of England than there is in the south.
So I think one of the things that the public will see every day is how many people are testing positive for coronavirus. Remember, a lot of those are people who will be relatively won't have a massive impact on them. We know that most of the deaths, over 80% of the deaths, have been for people over the age of 70. So it's very important to look at deaths. But if you look at the southeast of the country now and the southwest of the country, people are dying having tested positive for COVID, but the number of people dying is no higher than what you'd expect for the time of year. So that does give some indication that people are dying from COVID, Mike, but potentially they may have died anyway.
Right.
But it's quite clear the data showing in the north of the country, we are having excess deaths. So what excess deaths are is if you look at the number of deaths in any 1 week in the particular part of the country, what you would expect based on, say, a 5-year average, are we above that? Now, we've been above that in the northwest and northeast now for several weeks. And we know if you track that back, say, 2 months ago, we've had high cases in the northwest and northeast. So my criticism, I think, from the national lockdown is that the data and the evidence suggests that some parts of the country is lower, some parts of the country is higher. So you target your policy where you know it's higher, because where do you draw the line? Do you have a Europe lockdown? Do you have a UK lockdown?
Right.
Do you have a country lockdown within the UK? You've got to look at the data and have a proportionate response to kind of control the virus.
Yeah, exactly right. And when you say it's above average in the north and northeast and northwest, how much above the average is it?
So we're talking about 30% in the northwest at the moment above average. Luckily, we've started seeing over the last, say, 2 weeks, hospital admissions coming down quite rapidly in both the northwest and the northeast. And then if admissions are coming down, that should lend itself to some deaths. But those admissions were starting to come down in the northwest before the national lockdown, actually when the tiered system was coming in. So I think there's evidence that the tiered system was working before we had that kind of
Yeah.
spooky Halloween presentation, which we've talked about before, where we was kind of Armageddon was going to happen, and
Well,
then we
right.
went into the
But
national
also,
lockdown
it
in
would be
England.
helpful if the government were as honest as you're being, Jamie, because, you know, for example, we see Kent going into a tier 3 lockdown, and we were told that was because of an increase in hospital admissions in one very small part of Kent around the Thanet area, and yet the entire county gets locked down into a point where nobody can do anything.
Well, I think transparency has been one of the kind of the biggest casualties with data from this pandemic.
Yeah.
Data has been wheeled out. We see graphs saying, I think in Wales, to justify closing the pubs, is that 1,700 people were going to die over the winter if we didn't close the pubs and hospitality. I've not seen how that has been calculated. It's not been kind of made available, etc. And ultimately, the public need to know what the data is showing. I'll say I tweet on a daily basis showing the hospital admissions, the cases, the deaths. It's quite clear, you know, the second wave has had detrimental impact in some parts of the UK more than others. But a blanket approach where you just treat everything the same, or close all the pubs in one country or lock down the whole of another country, we know a lot more now than what we didn't know in March. We, you know, in March we didn't know who would die from the virus, so maybe it made more sense to do what we did back in March. But now we know far more than we did then, and what we also know now, Mike, is that for people who know they're vulnerable, people in certain age groups, they are socially distancing and etc. So people who are really vulnerable, who are really scared of the virus and may die if they catch it, well, they can avoid the pubs, for example, in Wales. They don't need to go to the pubs. So we know a lot more. We need better transparency. And I would say the data clearly shows that we're on a downward trend, which is a good thing.
Absolutely. Jamie, thank you very much indeed. Jamie Jenkins there, former head of health analysis at the Office for National Statistics, talking an awful lot of sense, but also using data in a way that it's supposed to be used, which is to tell the truth. Why can't the government do that? Why do they find it so difficult? Jonathan Van Tam, JVT as he's now known, comes out there and makes all sorts of statements, makes all these kind of platitudes, talks about rates going up here, rates going up there. I've never heard the government say that there is a 30% increase in excess deaths in the north of England, but not in the south of England. Why can they not tell us that particular truth? What is going on